All right, everyone. Thank you for joining us. We are live during this Q&A session here tonight. You're on with Dr. Deigni. I'm a board-certified plastic surgeon, and I practice in Houston, Texas. I specialize in body contouring procedures. I do the mommy makeovers, the breast surgery, breast lift, breast reduction, breast augmentation, BBLs, fat transfer, liposuction. My signature procedure is the drainless tummy tuck. And so please go ahead and ask your questions. It goes along for you guys also on Instagram and YouTube. Go ahead and post your comments, post your questions. Let me know what you're interested in discussing tonight. If you're considering having plastic surgery over the next couple of months, by all means, contact us. Our office number is 281-724-3138. I do have some topics down that I jotted down. You guys asked great questions throughout the week and over the weekends as well. So we've definitely got plenty to discuss. Hey, it's Junie says tummy tuck and lipo. Yes, tummy tuck and liposuction. Those are procedures that I perform quite often. And my patients who want them, yes, we can combine those procedures in one setting. So all the procedures that I do are same day procedures. You'll be able to go home the same day. You don't have to stay in the facility overnight. And we'll be happy to take care of you. So please put in your information in the bottom left of the screen here on TikTok. There should be a lead generation form so that you guys can put in your name, phone number, email, and a little message about what you're interested in having done. And we will reach out to you, discuss in further details, and then get you in for your consultation so that we can develop an adequate treatment plan for you and then get you on the schedule for your surgery. Didi is saying, I'm 5'7", 245 pounds. Is my BMI too high for a mommy makeover? So 5'7", 245, yes, it's still too high. The maximum weight for you to undergo your mommy makeover with me will be 222 pounds. So you have about 23 pounds to lose. You're not too far. That should be doable over the course of 4 to 6 months. You should be able to lose the 22 pounds, 23 pounds to get you to a BMI of 35 so that we can get you in a safe zone and we can move forward with surgery. But go ahead and contact us. Put in your information in the form, and we will reach out to you and take care of you. 7 Ladybugs is saying, Mostaz, I see you. Let me know if you have any questions, okay? 7 Ladybugs is saying thigh lift and bat wings. Okay, so you're talking about the extremities, so your arms and your thighs. Depending on the extent of your loose skin and fat on your thighs, I will probably separate those procedures because I try not to do all 4 extremities, arms and thighs at the same time. But we can definitely do that, and I'm happy to do that for you. You can scroll through the TikTok content as well. I've got some before and after pictures of my patients who've had some procedures done that you're interested in having. So please go ahead and listen to their comments as well, and also look at the before and afters to make sure you love the results, and then we'll be happy to take care of you, okay? Put in your information in the bottom left of the screen. For those of you guys who are joining us on Instagram and YouTube, we are live from Houston, Texas. I'm a board-certified plastic surgeon, and I practice in Houston. And our phone number is 281-724-3138. Okay. D. Liz is saying, do you have a recovery home for those from out of state? We have some recommendations, yes, for people who want to stay in a recovery home. But the way I do my procedures is in a way to make your recovery as easy as possible. The majority of my patients do not need a recovery home or a skilled facility for their recovery. They will either recover with, if they have friends or family, they'll stay at their place, or they'll stay at Airbnb or at a hotel. But we are definitely happy to make recommendations for you if you would like to stay at a recovery home. Perfect. Mia Emanuel is saying I need surgery. Okay, we will be happy to take care of you. Put in your information in the bottom left of the screen there. There should be a form, and we will reach out to you during the week to address your concerns and get you in for your consultation. Christy Reed is saying, do you have a simpler way to lift the jowls? So the jowls, so talking about some sagging in the face, over time we age, we lose the support in our structure in our face. We start to develop these platysmal bands. In some people, it's a lot more prominent. You've got some excess fat and things like that. The gold standard is to do a facelift and a neck lift to really get you some nice defined jaw lines and really reduce that. However, it depends on how severe those are. There are different ways that we can do in the meantime to get you some improvement. So definitely give us a call. Our phone number is 281-724-3138, and we'll be happy to see you and see what treatments you would benefit from. Please go ahead and share the live, share the link with your friends. Let them know that we are live taking questions from the audience, and we are happy to discuss body contouring procedures, anything from liposuction to BBLs, fat transfer, breast surgery, breast augmentation, breast lift, breast reduction, implants, fat transfer, things like that. So definitely don't be shy, ask your questions. Christina Luogon is saying, how does the drainless tummy tuck work? So when I do the drainless tummy tuck, the traditional way, you fix the separation of muscles, you transpose the belly button, and then you put drains in. When I do my technique, I actually don't need to put drains in because I put a lot of suturing to cover up everything here and close up that space where the fluid could collect. So that's how it works. It distributes the tension around your whole belly. You're able to actually start walking upright within 3 days after surgery. Most patients within that period of time, they're off their pain meds. By the time they come to see me a week after surgery, they're typically walking upright, they're off their pain meds, and they're driving in themselves to the appointment from the drainless tummy tuck. So it's a wonderful procedure, and it actually makes your recovery a lot easier and smoother. D-Liz is saying, what's the max BMI? Max BMI is 35. So if I just gave an example from somebody who was 5'7", she was 245 pounds, so she needs to be 222. Let me just give you a couple more examples. If you're 5 foot tall, your max weight will be 179. And if you're 5'2", your max weight will be 191. If you're 5'4", your max weight will be 204. And so forth and so on. But you can go on Google, you can type in BMI calculator, and you will be able to actually calculate what your BMI is. But my max BMI is 35. Anything less than that, we're good to go. Masa Sharif is saying, hey, Doc, hello from Chicago. Nice to see you. Thank you for joining us. And thank you for your gifts. D-Liz is saying, can you get a tummy tuck and a thigh lift? So you can. I've done the thigh lift combination with the tummy tuck. It depends on what type of thigh lift we need to do. I will combine it if it's the thigh lift that takes care of the excess skin that's only in the top part of the thigh. So your skin incision and your scar is limited to your groin. It hides well into the groin area. But if you have a lot of excess tissues that go all the way down to your knees, so you've got a lot of fat and a lot of loose skin there, and we have to actually extend the incision all the way down, I typically will separate the tummy tuck from that extensive thigh lift, because it's really demanding on your body to recover. I've done it before, but when I see the patients recover, I prefer to actually separate it out so that you can have a smooth recovery, and then you come back for your second procedure, have a smooth recovery, and it really helps your body. Great questions. All right, let's see here. Samantha Joy is saying, do you do outer and inner thigh lift for extreme weight loss? Yes, I do. So for that, it would be a combination of the body lift to treat the outer thigh. So I put the incision around your hip level, a little bit lower to kind of hide when you're wearing underwear. And it goes all the way around to treat the sagging in the butt area, the hip area, and then up the front part with a drainless tummy tuck and a mons pubis contouring. So I do a monsplasty as well. So treat that fupa area. So that's what helps to treat the midsection, so your outer thigh, and then the inner thigh lift is what I'll do to treat that part. But I will probably separate those because those are two big surgeries and the recovery is going to be really tough. So I usually will separate those. Mo is saying, I'm 5'2", weigh 146. Is that a good weight for lipo 360? 5'2", 146, yes. You can come in. We will be happy to do lipo 360 on you as long as you don't have any medical problems that will preclude you from having general anesthesia. We should be able to move forward with you and do your surgery. So put in your information in the bottom left of the screen on TikTok here. We'll be happy to take care of you. D-Liz is asking, how much is the consultation? So the consultation appointment fee is $150, and that goes towards your surgery. So essentially, the consultation turns out to be free or included in with your surgery. Again, our phone number is 281-724-3138. Go ahead and contact us. For those of you on the other platforms on YouTube and on Instagram, go ahead and leave a comment or DM us directly, and we will be happy to reach out to you and take care of you. All right, Maria Gonzalez is saying, I'm 53 and I weigh 200 pounds. So at 200 pounds, if you're 5'3", then your BMI is 35. And at that point, we can move forward with surgery if you want to have some surgery. However, I always recommend that you lose some weight to get you in a safer zone BMI-wise. But it all depends on what your height is. If you're 5'10 and you weigh 200 pounds, that's fine. Your BMI would be less than 35. We can definitely move forward with surgery. So contact us and we will be happy to get you on the books for your consultation. Plus Size Doll is asking, do you do telehealth consults? Yes, we do. Thank you for joining us. We do telehealth consultations for patients who are out of town, out of state, out of country. So those of you who can't come to see me personally, in person for your consultation, we will start with the virtual consultation as the telehealth. And so you guys will fill out your medical form. I'll get your medical history, and you will also send us some pictures so that I can get ready and prepare for our consultation so that we can have a very productive consultation. I can then come up with the appropriate treatment plan once I understand what you're wanting to have done, and we discuss it together. And then when you're ready to actually book your surgery, we can definitely get the ball rolling and get you in for your pre-op visit, at which point we'll do the consents, the pictures. And so you'll be seeing me at least 2 or 3 times before you have surgery. So that's very important as well. If you're looking to have surgery, I actually urge you to be able to meet with the surgeon, either virtually, in person. Definitely you want to before surgery. And be sure that you're comfortable with them and you can have all your questions answered. Tomo is saying 5'4", 202 pounds. I have held this weight for 2.5 years after losing 90 pounds. Okay, 5'4", 202 pounds. Yeah, so you're right at a BMI of 35. So depending on what you want to have done, we can definitely move forward. You've been stable at that weight. So come and contact us and we'll be happy to discuss further and get you in for your surgery. Plus Sized Doll. Again, the form is on the bottom left of the screen there on TikTok. For you guys on YouTube, just post a comment or call us at 281-724-3138, as well as you guys on Instagram. You can DM me directly as well. So 5'6", 288 pounds, how much weight should I need to lose before surgery? So 5'6", 288, you need to be at 216 pounds. So you need to lose 70 pounds. So go at it. Start walking, decrease your sizing, food-wise, increase your activity level. Definitely increase your activity level. Do some resistance training, start walking around your neighborhood or park as long as they're safe. Go to the gym, pretty much increase your activity level reduce your portion size, and gradually you'll be able to lose that weight. Or you could start with some weight loss initiatives. We do have some weight loss programs available for our patients. If you want to get on the medications for that as well, just give us a call, contact us, and we'll be happy to discuss that further. Deezen R. Lipo question, severe back pain. How long should it last? I would recommend that you discuss that with your surgeon. Definitely call them during their office hours and discuss it with them. Make sure that they examine you, make sure that there's nothing that's that they're missing. But if it's liposuction and just like a nerve discomfort from the liposuction, it will take probably a couple of months for you to establish regular nerve sensation. So, but everybody heals differently. But definitely you want to make sure that you follow up with your surgeon's team to make sure they're not missing anything like a seroma or an abscess or something that's causing some back pain. I am Erica, 5'1", 177 pounds. And she would like to have a tummy tuck. Yes, you'll be less than the BMI of 35, which would qualify you in my hands to be able to move forward and do the tummy tuck. So definitely contact us. Put in your information in the bottom left of the screen or DM us, and we will be happy to take care of you and get you on the books for your surgery. Ashley, did you say what the recovery time is for inner thigh and tummy tuck for loose skin? So the inner thigh recovery depends on the amount of excess skin and fat that you have and how we have to do the thigh lift. If it's the one where the thigh lift is the thigh incision is limited to the groin area, your recovery is a lot faster than the one that has to go all the way down to the knee to really treat the whole thigh. So that depends on your recovery. So for those, it would be, I wouldn't do the extended one that goes down to the knee in combination with the tummy tuck, but the one that hides in the groin area only and treats the top part, if that's the only area that needs to be treated, then I can combine that with the thigh. It will be about 2 to 3 weeks of recovery when you combine those two surgeries. The other big surgery will be by itself about 3 weeks of a recovery process. So if you combine it with other stuff, it will be even more. Kenya O. Do you do awake arm lifts? I do not. I do all of my arm lifts with you asleep. It is a lot more comfortable, both for you and for me, and safer. Avo. Hello, what is the recovery time for a mommy makeover? Great question. It all depends on the type of procedures that you include in your mommy makeover. But on average, it'll probably be about 1 to 2 weeks for you to recover from your mommy makeover. All right, let's see. Mia. I can't wait to see you for Lipo 360. You're only 20 minutes from me. I'm saving all year. Wonderful, wonderful. You're local. We will be happy to take care of you. I appreciate you participating in the lives. Continue to listen in, ask your questions. I do a lot of educational videos to give you as much information, valuable information, so that you are well prepared for your surgery. And if you're wanting to travel to Houston to have surgery, you are definitely well prepared as well. So that's good. Plus size doll. Okay, thank you. I used to be 400 pounds, still going. Wonderful. You're very close. Congratulations on your weight loss. So you probably have a lot of loose skin that you definitely would like to have removed. You're very close. I think we said was probably another 70 pounds. You're very close. Or yeah, I think one was 25 pounds. You're probably 70 pounds. You're very close. Get that, go get into it, and then contact us. Again, it also depends on where that weight is, where you carry that weight. I've operated on patients who have higher BMIs than 35. By examining them, I could see where they carry that weight, and depending on what surgeries you want to have done. So the hard answer is BMI cutoff of 35, but there's always a case-by-case basis. So definitely continue on your weight loss journey and give us a call, come in and see us, and we'll be happy to get a treatment plan going for you. Lauren, how close to goal weight should someone be before scheduling a consultation? Okay, I want you to be within 10 to 15 pounds of your goal weight. At that point, if you're coming in to have your surgery, usually the turnaround time will be probably anywhere between 3 weeks to maybe 6 weeks, depending on how healthy you are or not. Hello, Patricia. Thank you for joining in. That's one of my patients. Yes, good. So definitely come in when you're about 10 to 15 pounds from your goal weight. And that should be plenty of time for you to be able to move forward with a little bit of weight loss before we actually get the surgery done. So within 4 to 6 weeks, you should be able to lose a couple pounds to get you closer to your goal weight. Tammy Williams, 69. Hello, do you accept insurance? No, we do not accept insurance. The majority of the procedures that I do are not covered by insurance. Our patients pay out of pocket. And thank you very much for joining. Our patients pay out of pocket. We also offer financing plans for patients who would like to get that done. Okay, so we just got a restricted warning. I'm not sure why people are posting restrictions for this content. If you don't like the content, just skip out and leave the live. There's no need for you to restrict the content for other people who are interested in having them. I don't understand people. But anyways, for those of you who are still here, I appreciate it. Ask your questions. I'll be happy to answer them and take care of you. All right, so let's see here. Miss Oni, are there recovery nursing houses for those who are traveling from out of state? Yes, there are. And we do have recommendations for those. But the way I do my procedures, it makes your recovery and your care a lot easier. So you don't actually need a nursing home or a nurse house or a skilled nursing facility. You can actually get it recover with what we require is that you come with an adult. So you need adult supervision for the first 24 hours at least after surgery. After that, you can continue to recover by yourself. And typically, our patients will stay at a hotel or an Airbnb, or if they have friends or family, they'll stay with them. Miss Oni, follow-up question. How soon can the patient fly back home post-tummy tuck? So usually you'll fly out after a week. I'll see you within that week after surgery, depending on the extent of your surgery. But usually it's about a week, and then you're able to fly back home and continue to recover then. And then we will continue to follow up virtually. And we'll have 5 follow-ups during the first 6 months. And you'll typically come back usually around 3 months for your post-op pictures and an in-person follow-up as well. Thank you. Great questions. Let's see here. I think we have a couple more coming in. Like I said, these have been some good questions. I've also jotted down a lot of them actually have already been answered. Talked about the recovery time, financial options, talked about what the drain during this tummy tuck was, staging procedures, the BMIs, perfect. Oh, okay. There's another, we talked about out-of-town patients as well. So you guys are really taking every subject off the list here. That's great. Tomo, is the surgery done at the hospital or private clinic? So it's done at a same-day surgical facility. You undergo general anesthesia. It's not done at a private clinic. I see my patients in my private office, in my private clinic, but I don't operate there. I operate at a surgical facility, but it's not a hospital. So it's different than a hospital system. It's a same-day outpatient surgery. Tropical Exotic Treats. Nice to see you again. Any specials coming up? We always have some specials, so definitely give us a call and let us know what procedures you're interested in having. And we will take care of you. Linda, my patient coordinator, is always happy to accommodate you for your surgery. So definitely give us a call and come in and see us. All right, let's see here. So moving on the list again. Oh, okay. All right. Hey, Laura, how are you? Coming up. What's the difference between a hospital and a surgical facility? So a hospital is where a lot of sick people will actually stay. So a hospital, you can think about it. They have in-house patients stay overnight after the surgery. There are also people that go there from different specialties and they're sick. So I avoid operating in hospitals to avoid having any risk of communicable diseases, infections, and all that stuff. So I operate at a outpatient surgery center. So and where I operate, it's mostly plastic surgeons that operate there. So patients are healthy and you don't have that risk of people who are from all over the place that come in and who are really sick. So we definitely don't want to be putting you at risk for those. That's why I operate at these standalone outpatient surgery centers. So good, very good questions. I was going to say, yes, somebody also asked about lymphatic drainage. Do I have to get lymphatic drainage treatments after the drainage tummy tuck? The answer is no. The reason why is because the drainage tummy tuck technique that I use decreases your amount of swelling. It actually allows for your body to naturally reabsorb any little bit of fluid that collects, and you don't develop a seroma, or very, very, very low risk of developing a seroma and having issues. And so lymphatic drainage treatments are not really necessary. You can have them if you want to. I won't restrict you from having them, but they're not required. When you combine Lipo 360 with the drainage tummy tuck, then I have you do the lymphatic drainage treatments, because that will really help to reduce the amount of swelling in your whole body and accelerate the healing process as well. So perfect. Thank you very much, guys, for joining us. I appreciate it. Go ahead and post your comments. Let us know what you're interested in. If you're wanting to have plastic surgery, I specialize in body contouring procedures. My specialty is the drainless tummy tuck. So when I do my tummy tucks, I do not place any drains, so you can actually heal a lot faster. And I do that with all my surgeries, from body contouring. So arm lift, breast lifts, breast reductions, body lifts, thigh lifts, all of those are without, those are all without drains. Okay. Only true wife. I really want a brachioplasty, but I'm terrified of the scar. Does it always have to be done elbow to armpit? Great question. So the brachioplasty does not always have to be done all the way down to the elbow. So the reason we do it is patients will come and they'll have what they qualify as bat wings. If you have that excess skin that's bothering you and it goes all the way down to the elbow, we have to place that scar there if you really want to get that treated and removed. Some patients will come in and they'll have a little bit of looseness on the upper part of the arm, in which case I'll hide the incision just in the armpit. I'll do some liposuction and some energy-based treatment like some J plasma, and then I can remove any excess skin that might be bothering them, but it's very limited to just this part. If you have excess skin that bothers you out here, there's no true way to actually remove it completely. We can improve it by doing some liposuction and probably some J plasma, Renuvion skin tightening treatment, but it's not as drastic as the full brachioplasty with the scar. But if you don't want the scar, we can do that. It definitely will be an improvement. So I discussed that with my patients, and we choose which treatment plan will be best based on what your desires are and what you want to have done. So great question, and thank you for asking. I appreciate that. And please go ahead and contact us, DM us, or call us. Our phone number is 281-724-3138, and we will be happy to take care of you. Capri Young 758. Do you have in-person consultations? Yes. So I see patients on Mondays and Thursdays in my office, and I actually see you during your consultation. I'm learning that there are patients, some of you that are going to certain facilities, but you actually never get to meet the surgeon who's going to be operating on you. So please, my recommendation is make sure that you're able to talk to the surgeon that's going to be operating on you. Do your research, make sure that they are a board certified plastic surgeon that specializes in these body contouring procedures. You can also go online. This is public information. It is called, the website is abplasticsurgery.org. So the American Board of Plastic Surgery, abplasticsurgery.org. On their website, you can click on the homepage. It says, they have a box that says, is my surgeon board certified? Click on it, put in the information, the name of the surgeon you're interested in going to see, and then click submit. And if it doesn't come back saying that they are certified, board certified, one, verify that you don't have a typo in their name. But then if you have entered that name correctly and it doesn't come back with a certification date and how long that certification is good for, then that surgeon might not be a board. Well, that surgeon is not a board certified plastic surgeon. They might not even be a plastic surgeon. So there's a lot of other physicians that do that want to get into the aesthetics space, that want to do liposuction, breast lifts, breast augmentations, facelifts, fat transfers, BBLs, and things like that. So please be careful. Make sure you do your research. Make sure that you are able to actually confirm that the surgeon you're interested in seeing has the credentials to do what they're doing. Mom123, hello, do you do blepharoplasty? Do you recommend for dark circles, and does the scar fade? Yes, I do blepharoplasties. I actually have one coming up soon. And I do the upper eyelid and also do the lower eyelid. So it all depends on what you present with. So please go and see a board certified plastic surgeon that specializes in these procedures. If you're in the Houston area or are wanting to travel to Houston for me to do your surgery, by all means, put in your information in the bottom left of the screen. There should be a form where you can put your name, email, phone number, and a brief message about what procedure you're wanting to have done. And we will reach out to you and get you in for your consultation. And then together we'll come up with a treatment plan that's best for you. Some people may need some fat transfer to restore volume loss. Some people have a lot of fat bulging, and it actually gives them a lot of a tired look, and they've got some fat bulges through their lower eyelid. We need to fix that. Some other people have a lot of loose skin and redundant skin in their upper eyelid, so they complain of having to really pull their eyelid up to apply makeup and things like that. So it all depends on what you present with and what the treatment will be. But yes, the scar tends to fade well especially on the upper eyelids, but on the eyelid surgeries, yes. All right, very good, very good. Perfect. Ask your questions. We'll be happy to answer them. Okay, don't be shy. Okay, guys, let's see. We've been taking all of these topics off the list. Perfect. Okay, one question that I did get was patients talking about having multiple C-sections and wanting to have a tummy tuck, or even they've had a hysterectomy. Can they get a tummy tuck as well? So that scar typically is around the same area for the C-section or the hysterectomy scars. I will remove those scars when I do the Dreiner's tummy tuck. So definitely come in if you've got that excess pannus or bulge around that C-section scar or hysterectomy scar that bothers you. We'll be happy to take care of you. All right, thank you, Linda E. asking other in-office procedures. So yes, so if we're doing the upper eyelids, I can do that in the office. The lower eyelids is a little bit more involved, so I want you to be completely asleep. But the upper eyelids is less involved, and I'm able to do that with you awake under local anesthesia. I also perform lipoma excisions. Lipomas are fat collections that we can do depending on where they're located on your body. Some will have them like around their back, in the belly area, on the sides, the flanks, and things like that. Then I can do that depending on how big it is, where it's located. I could probably do that also in the office. Other procedures that I do in the office are labiaplasty. If you've got some irritation, elongated, asymmetric labia minora, we definitely will be able to treat that in the office. I also offer treatments for stress urinary incontinence. We do the Thermiva treatment in the office. There's no anesthesia required, no restrictions after your treatment, and it usually is a treatment about 20 to 30 minutes in the office, very comfortable, and you come for a series of about 4 to 5 treatments to start off with, and then you come back usually every quarter for maintenance treatments. The real Kit Kat 70. Are your tummy tucks performed in the office or in the hospital? Neither. I perform them in a surgical facility, which is a outpatient surgical facility. So I don't do them in the office, and I don't do them at the hospital. It's a same-day surgical facility. Jackie's Treats. Do you perform rejuvenation of the mommy parts? Yes, I do. I do vaginoplasties. I also do labiaplasties. Vaginoplasty is a surgery that I do for women who have had multiple pregnancies, multiple children through natural birth, and they feel that the vagina has a lot of laxity. It's gaping open. They feel like they're getting more infections and things like that. Just really changes the flora and the balance of the microbiology down there. And I've had some patients who've had some complaints because they also had episiotomies and the perineum was not fixed properly. So there's a lot of reasons why women will want to have rejuvenation of that area as well. So definitely we perform it. We'll be happy to take care of you. Put in your information in the bottom left of the screen. There should be a form there, or contact us. Our phone number is 281-724-3138. And we'll be able to take care of you and help you. You're very welcome, Tracy Jackson. I'm glad you enjoy the information. I appreciate it. And we're looking forward to seeing you guys in the office or virtually for your consultation. Yes, and also for less invasive, so non-surgical options to rejuvenate the mommy parts, we offer Thermiva in the office. That for that you don't need any anesthesia. There's no cutting or needles or things like that. It's very comfortable. It takes about 20 to 30 minutes. Thank you very much for the heart, Nicole. I appreciate that. It takes about 20 to 30 minutes for your treatment. And you will have a series of about 4 treatments. Usually they're 1 month apart, and that really helps to kickstart the collagen regeneration. It increases blood flow. It helps to improve sensation. If you're also suffering from some vaginal dryness, it will help to improve that with some lubrication. And also, like I said, it also increases sensitivity, so it helps. So definitely give us a call. We will be happy to get you in. And if that's the treatment that you would like to go with, absolutely, we'll be happy to get you in for that treatment. Like I said, it's in the office. Women will come in, they get it done, they go back to work the same day. There's no restrictions. You can go and work out. You can engage in sexual activity. You can do pretty much whatever you want. There's no restrictions whatsoever, activity-wise or even medication-wise. So, perfect. All right, so let's see here. We're coming up on last questions here that I see so far. Okay. All right, so let's see. Let's go down the list again. Like I said, a lot of you have been asking pretty much all the questions. Okay, so we got 10 questions that were asked, and you guys have asked them all, and we've covered them on this live. That's perfect. Another question I think that wasn't asked today, but comes quite often during my other live sessions and also on other videos, is medical health problems. So I posted a video today about anemia. Anemia is one of the medical problems that women will frequently come present with, especially iron deficiency anemia. So we definitely want to make sure that your hemoglobin levels are within the normal range, so close to 12, anywhere between 11.5 and 15 would be the normal range. Anything less than that means that you're anemic. My cutoff for the hemoglobin is 10 for these big body contouring procedures. But if it's a breast augmentation with implants, then I have a lower threshold cutoff for that. But definitely we want to make sure that you're on your iron supplementation, daily iron supplementation if you have iron deficiency anemia. And we definitely want to make sure that that hemoglobin rises to more of a normal level so that we can move forward with surgery. The other medical problem that people also talk about and ask about is type 2 diabetes. What is the hemoglobin A1C level for those procedures, for those patients? So my cutoff is 7 or less, and you're good to go. So I've had some patients who've come in who've wanted to have lipo 360, BBLs, fat transfers, breast surgeries, tummy tucks, and things like that. But their hemoglobin A1C levels were 12, 14, or even 9. That is too high. The reason we want it down 7 and below is because when your blood sugars are not adequately controlled, you are not going to be able to heal. So we definitely want to make sure that you are able to heal. These are all elective procedures, so there's no need to rush into it. We have to make sure that we get everything medically optimized, whether it's high blood pressure, anemia, type 2 diabetes, or any other medical problem, before we move forward with surgery. Tomo, thank you for your questions. I appreciate that. If you take herbal supplements, how long before surgery should you stop taking them? Typically for herbal supplements, so probably around 2 to 3 weeks before surgery, because we don't want them to interfere with any of the medications with anesthesia, and also medications that we're going to be giving you after surgery. But great question. Truly blessed one, Dorothy. What's the weight limit or BMI for inner thigh removal? So great question. For these procedures, the body contouring procedures, your BMI max is 35. That's my cutoff for me to be able to do these procedures. The reason being, the higher the BMI, the higher the risk of wound healing problems and surgical complications. Some wounds may not heal well. You may have a lot of openings and things like that. So we try to limit that and reduce that as much as possible to make it more comfortable for you to be able to recover, especially with the inner thigh surgery. That is an area that is prone to some openings and some small wound healing problems because of the location. The groin area is not the cleanest. There's a lot of sweat. There's a lot of other bacteria, especially when you go to the bathroom, and you're always standing up or even sitting down. All of that fluid and pressure goes down right into the groin area. So it is really an area that is delicate, and we want to make sure that we improve your success of healing. So you definitely need to bring your weight down to a safer zone so that we can give you the best chances to be able to heal well. You can also go through my TikTok feed. I've created some playlists, so you should be able to see, I think it's in the body contouring after massive weight loss patients. There are some pictures before and afters of some patients who've had the thigh lift. There's 2 types of thigh lifts. The one that's the incision stays in the groin, and there's the one where the incision goes all the way down to the thigh. So definitely take a look at those. You're very welcome, truly blessed one, Dorothy. Look forward to taking care of you. Contact us, come in for your consultation, and we will be happy to help you with your body transformation. Jackie's Treats is saying, if you are under prescription GLP-1, should you refrain before undergoing a tummy tuck? Yes. So I put my patients who need to lose some weight before surgery on GLP-1s as well. And I will stop them about 3 weeks before surgery. You don't want to take it. So a month before will be your last dose. You want to have a good amount of several weeks to be able to actually clear out your digestive system, especially your stomach as well, so that it reduces your risk of aspiration and problems during surgery. So definitely we will address that in your consultation, and then make sure that you stop those at the appropriate time before surgery, so that there's no complications there from that. Good question. Thank you. Thank you very much. All right. Okay, so let's see. A couple more questions, and we will wrap it up for tonight. We've been having some pretty bad weather, a lot of rain, and it is starting to get a lot colder, even down here in Houston. I'm sure it's pretty cold where you guys are. especially if you're north of Texas or north of Houston. I know Dallas is going to be getting a lot of really cold, sub-freezing temperatures. But I think the East Coast too is going to be getting some cold fronts. So, but hey, it is winter, and I'm actually happy about these colder temperatures right now because it tends to get really hot too soon. Tomo, okay, if you're taking metformin, yes, I'd have to look into it detail-wise, but yes, there is a time frame when you will stop taking the metformin. I just don't remember it right now, but definitely we'll have to make sure we give you that information. Absolutely. Thank you very much, Mel. Too. I'm glad you really appreciated the session. And again, I do these live sessions time permitting. If I'm not operating or traveling or recovering from a long surgery, on Tuesdays and Thursdays, starting at 7 p.m. usually around 7 p.m. Central Standard Time. So please go ahead and contact us. You're very welcome, Tomo. I appreciate you joining us and participating in the live. Thank you very much as well, truly blessed one, Dorothy. I try to give you as much valuable information as I can to really help you in your search for a safe and qualified surgeon so that you can safely go through these procedures and enjoy your life, enjoy your transformation. Hopefully, I've been providing that tonight. Definitely go through my content. You'll see a lot of testimonials, video testimonials from my patients. My patients are really kind also and generous to actually continue to follow us even after their surgeries. And a lot of times they will post their comments as well and answer your questions during the lives, which I really appreciate it. And hopefully that's a testament to the kind of family, I guess, we build here on TikTok and other social media platforms to get you guys in, to feel part of the family, and also to communicate with others and share that information so that we can get you guys in safely, get your surgeries done, and then enjoy the rest of your life. So I think this has been definitely a wonderful session. We always appreciate everybody's comments. I think we're probably going to wrap it up. I know somebody probably posted something to TikTok and reported because they have significantly reduced the reach. And so we're going to wrap it up for tonight. I appreciate everybody. Thank you so much for asking your questions. Have a good night, and God bless you. Again, contact us. We're here for you. And until next time, have a wonderful time, okay? Have a wonderful night. God bless you. Bye-bye. All right, guys. Thank you very much for following us on Instagram. I appreciate your comments, and we look forward to taking care of you guys, okay? Thank you. Hey, JGB5064. I was just about to shut it down. Do you have a quick question before I end this live? We've been going for almost about an hour now, and we're just wrapping things up. If not, then you can always reach us by DMing us directly, and we will be happy to get you in for your consultation virtually if you're out of town or out of state or even out of the country, or if you're here in Houston or in the neighboring area